On December 18, 2024, California faced a situation unlike any before. Governor Gavin Newsom declared a state of emergency. This was no ordinary emergency, it was due to bird flu. But this time it wasn't just birds. The virus had jumped to cattle. This was unprecedented. The H5N1 bird flu virus had crossed the species barrier, infecting dairy cows in Southern California. This declaration was a sign of the seriousness of the situation. It meant the state could now access resources quickly. It could respond to the outbreak with flexibility. The emergency declaration was a wake-up call, not just for California, but for the entire nation. The situation was alarming because this strain of bird flu was highly pathogenic. This meant it spread rapidly and had a high mortality rate in birds. Now, it was infecting cattle. This raised concerns about the potential impact on human health and the economy. The emergency declaration was a necessary step to address this growing threat. The outbreak began quietly, almost unnoticed. The first cases appeared in early December 2024. Dairy cows on farms in Fresno County started showing symptoms. The culprit was the H5N1 virus, a highly contagious strain of avian influenza. This virus had been circulating in bird populations for months, but this was different. It had made the jump to mammals, specifically cattle. The virus spread quickly. It didn't stay confined to Fresno County. Soon, reports came in from other counties, Tulare, Kings, and Kern. These counties, all located in California's Central Valley, are the heart of the state's dairy industry. This wasn't just an isolated incident, it was a full-blown outbreak. The virus's rapid spread was a cause for concern. It wasn't clear how the virus was being transmitted. Was it through direct contact between birds and cows, or was there another vector involved? Scientists were baffled. They raced against time to understand the virus and its transmission patterns. As the virus spread, so did fear. People were worried. Could this virus jump to humans? The California Department of Public Health, CDPH, moved quickly to address these concerns. They issued statements assuring the public that the risk to human health was low. So far, there were no reported cases of human infection in California. The CDPH emphasized that all the infections were linked to exposure to infected cattle. There was no evidence of human-to-human transmission. Still, the CDPH wasn't taking any chances. They were closely monitoring the situation. They were also working with federal agencies like the Centers for Disease Control and Prevention, CDC, to track the virus and assess the risk. The CDPH also issued guidelines to prevent the spread of the virus. These guidelines included basic hygiene practices like frequent hand washing and avoiding contact with sick animals. They also advised people to cook poultry and eggs thoroughly to kill any potential virus. The CDPH was determined to stay ahead of the virus and protect public health. The outbreak sent shockwaves through California's agricultural industry. The state's dairy industry, a $7 billion giant, was facing its biggest threat in decades. California is the nation's leading milk producer, and the outbreak put this at risk. Farmers were worried. Their livelihoods were on the line. The virus had already claimed the lives of thousands of cattle. To control the spread, authorities had no choice but to order the culling of infected and exposed animals. This meant economic hardship for many farmers. They were losing their animals, their income, and their future. The outbreak also had a ripple effect on the entire dairy supply chain. Milk prices were expected to rise. Consumers were bracing for shortages. The outbreak highlighted the vulnerability of our food system. It showed how quickly a single virus could disrupt the delicate balance of supply and demand.